and welcome. My name is David, and this is Leading the Way. Alright guys, so today we're talking about the coronavirus, also known as COVID-19. It has now been detected in over 200 countries around the world, and we are in a global pandemic. An event of this magnitude has not happened since the 1918 Spanish flu. Now there's a lot of information going around, some good, some not so good. Here at Leading the Way, we want to give you good information that'll help protect you and your family, hopefully help flatten the curve, and get us back to normal as soon as possible. So how are we going to do that? One of the ways we're going to do that is by wearing masks. Now I have a few in front of us today that I want to go over, but before I do that, we need to understand the word viral load. Now, when a sick person coughs into the air, and that flies into a person that is not sick, and that comes into their body, the amount of virus that gets into the non-sick person is called the viral load. The less virus that you get into your body, the better your body's going to be able to do at fighting off the virus. And that's why we're wearing masks, okay? So let's go over a few. The first one I have here is made by 3M. This is the 7500 model. And this is comparable to the N95 respirators that many of the nurses and doctors are wearing, okay? Now, if you're wearing something like this, it filters out 99% of the particles in the air, thus keeping you very safe from things like the coronavirus. And that's why nurses and doctors wear these things, because it actually does work, right? The problem is there's not enough right now, and with global supply shortages, we need to figure out other options to protect ourselves. So this is the best option, but because there's a lack of quantity, we're finding other options, right? So this is the second mask I have today. This is made from a non-woven material, right? I got this at Home Depot a few weeks ago, okay? And this is similar to the surgical mask that people may be talking about. Now, the reason non-woven material and surgical masks are better than cotton is because they're better at blocking particles from entering your body. Okay, that's the whole thing. Blocking the particles, reducing the viral load, right? So the surgical mask, as we'll look in the data a little bit later, reduces your chances of getting the virus by a factor of 4. Okay? So that's a lot of protection. And not only that, but it's also going to stop the virus from exiting your mask if you're sick. And as we now know, asymptomatic people are spreading the virus. So everybody needs to be wearing a mask, right? The third mask we're going to look at today is made out of cotton. It's more of a fashion mask. My friend Eugene is actually wearing one. He likes it. And this can be compared to something you can make at home, right? Now I want to put this on to just show you what it's doing. Okay? So even though this is our least protective mask, like, you're seeing what's being affected. It is blocking air from getting in. It is blocking air from getting out, okay? This is affecting the amount of particles getting in and out of your body. So this is important, right? So let's get into some of the data, okay? So the article I want to get into was written by a professor, Sui Huang, and he is a molecular and cell biologist. He's a PhD, very smart guy, right? Here's his article. COVID-19, why we should all wear masks. There is new scientific rationale. The official recommendation in the United States and other Western countries that the public should not wear face masks was motivated by the need to save respirator masks for healthcare workers. Okay, I'm going to pause there. The reason they're telling you not to wear a mask is because they don't have enough. The leadership has not planned properly for a pandemic of this size, and now they're asking you to put yourself in danger because they haven't done proper planning. Here at Leading the Way, we don't agree with this, okay? We are going to make masks, we're going to find masks, and we're going to wear masks, right? Let's continue. There is no scientific support for the statement that masks worn by non-professionals are not effective. In contrary, in the view of the stated goal to flatten the curve, any additional, however partial, reduction of the transmission would be welcome. Even that afforded by the simple surgical mask or DIY mask, which would not exacerbate the problem. The latest biological findings on SARS-CoV-2 viral entry into human tissue and sneeze/cough droplet ballistics suggest the major transmission mechanism is not via the fine aerosols, but the large droplets, and thus warrant wearing of a surgical mask by everyone. And we're going to prove that even more as we go through the article. Okay? So this is the first graphic I would like to look at. And it shows, the bell curve. We've all seen this on the news, right? If nothing is done, the peak at 47 days is 57 million cases, right? Now we're already social distancing, but what if we can add masks? What this is showing is if we're doing both these things, the peak is reduced by 25 million cases. Pretty good. 25 million cases. And also pushed back by 2 weeks. Now that can give time for people to make more ventilators, to hire more doctors, nurses. This is valuable time, right? This is important stuff. So let's continue. I'm going to skip down here to the logic. Of course, no mask, be it the tight-fitting NOSH, approved N95 respirator mask, or the loosely worn surgical mask, provide perfect 100% protection. But imperfect protection does not mean completely useless. Much as a glass not full need not be empty. I would gladly accept a glass of water filled to 60% when I'm thirsty. All right, so I'm thirsty, right? And if this was empty, I would be sad, but it has some water in it, so I'm not. This is the logic, and I see what he's saying here, okay? But in our binary world, the official message that surgical masks are not effective may have sent the wrong message, that they're absolutely useless. Sadly, with the black and white picture painted by officials, the discussion about effectiveness of masks has been stifled, and with it the possibility of incentivizing industry to ramp up production of these masks, right? So it's not black and white. A surgical mask will reduce the viral load by a factor of 4, and that's a big thing, okay? Any type of mask you can be putting around your nose and mouth are going to protect you. And we're going to continue to see that as we walk through here. So the mechanics, right? Here we have a really great graph. We've got a non-binary type here. We're going to call them they with a mullet. They is coughing. They is sneezing. These are the large spray droplets, right? If you're coughing, they can go up to 2 meters. Now that's about 6 feet. But the sneeze can go up to 6 meters. Now that's 36 feet. That's a long distance, guys. So masks are important, right? Let's continue. Now I'm not going to read through all this because that would take a very long time, but I'm going to hit the bullet points for you. Okay, so this is our next graph, right? Here we have a sick person coughing and sneezing. Here we have a healthy person. And where are those droplets going? In the nose and mouth. Okay? Now, the larger droplets, we now know, can be blocked by a surgical mask to an extent. That's another example of what's happening. The smaller particles are going to come down here and land in your lungs. Now, in order to get protection from that, you do need the N95 respirator or something comparable. Let's continue. Okay. What the authors found for inward protection warrants some questioning of the CDC's message that surgical masks are not effective. While N95 mask indeed filtered out 99% of particles, thus reducing the aerosol load by 100-fold, the surgical mask lowered the number of aerosol droplets behind the mask still by a substantial 4-fold. And that's what we're talking about, guys. Again, surgical mask reduced the virus by a factor of 4. Here's another great graph I'd like to look at here. This is really the most important one of this whole article. If you miss everything else and get this, that's all you need right here. Okay, so these are the different types of masks, and I've shown these to you today. This is a homemade mask, this is a surgical mask. These are the nice ones, right? Out of 100 particles, what gets through to your body? All right, this is a sick person, this is they're not sick, they are healthy. Out of 100 of those particles, with a nice mask, a nice respirator, 1 particle is going to get through. Wow. With a surgical mask, only 25 particles get through. Still a lot of protection out of 100. I like my odds there, okay? And even with the homemade mask, you are protecting yourself in a giant way, okay? Make a mask. Get a mask, wear a mask. Don't go to the grocery store without a mask, okay? Wear a bandana if you have to. All right, let's continue. This is what happens when now they is sick, okay? And they're using different types of masks. And this is what is getting blocked to other healthy people, right? With the nice mask, 30% of the particles are getting through. Even with the surgical mask, guys, it's blocking half the particles from getting through. So reducing something by half is huge, and we should all be trying to do that. Okay, let's continue. It gets into the biology a little bit here, and this gets very scientific. What I just want to show you guys here is this is the virus. This is kind of inside of your mouth or nose. This is how the virus attaches to you. Okay, it's the biology of it. There's another graph showing what's happening. Now, if you take what's happening with the biology, it says that most of the receptor sites are in the nose and mouth. Okay? So your most likely site of initial infection is the nose and mouth. And we know that that can be blocked by a surgical mask to an extent. So you're reducing the most likely way you're going to get sick, and that's important. All right? The smaller particles are also getting you sick, but they're not typically the ones that are infecting people, and that's important to know. Let's continue. All right, we're going to get down here to the implications. All right, it would be tragic if the wrong logistics and mechanics and biology, which has led Western governments to not encourage, if not stigmatize, the wearing of masks, it may have contributed to the steep rise of COVID-19. Given that the upper respiratory tract is a major site for SARS-CoV-2 entry into human tissue, wearing a simple mask, which exerts barrier function, that may block those big projectile droplets that land in the nose or throat, may substantially reduce the production rate to an extent that may be comparable to social distancing and washing hands. So if you add this to what we're already doing, this would then double the effect of mitigation and flattening the curve. And that's the whole goal here. We want to flatten the curve. Okay? Let's keep going. Looking forward, if we are soon loosening the lockdown due to the political pressure to sustain the economy, perhaps encouraging face masks to be worn in the public would be a good compromise between total lockdown and total freedom. And I agree. You know, here at Leading the Way, we think that protecting yourself is not black and white, much like most things in the world. And if you can protect yourself a little bit, it's better than none. Okay? So I encourage you to read this article, subscribe to this guy. Now, before we go, I want to show you a video that I found on Twitter. And this is a lady, that is working in Chicago. She's a nurse, right? And I'll just play the video and let you watch, and we'll see what she says.
I quit my job today. I went into work and I was assigned to a COVID patient on an ICU unit that has been converted to a designated COVID unit. None of the nurses are wearing masks, not even surgical masks, in the hallways when they're giving report to each other. I had my own N95 mask. I told my manager, I understand we're short on supplies, but let me protect myself. Let me feel safe. I have family that I have to come home to, and the way things are looking, this isn't going to get any better. America is not prepared.
Wow. Okay, this is rough. And let me be candid for a second. If you're working for somebody like this that is not looking out for your best interests, right? Not only are they not looking out for you, but they're punishing you because they have not planned properly. If you're working in an environment like this, I would encourage you to stand up to your leadership. Show them scientifically why they're wrong and help them to understand why you're doing what you're doing. This is important. We can actually use logic, data, and reasoning to influence our leaders. And if they aren't going to accept good information and data, they don't need to be leaders. Okay? And this is one of the reasons why I wanted to start this channel, is because now I've been watching what's happening with coronavirus for a little while now. Around February 6th, we really started to take it seriously here, started social distancing, taking measures to protect ourselves. And I've sat back and watched as leaders all over the globe, in the US, many other countries, have failed to give you the right information, have failed to protect you. And I'm not here to bash, I'm not here to point fingers. I'm here to give you good information that will help you and your family, right? So, until next time, my name is David, and this has been Leading the Way.